Maxillary canine. So we need to be careful of our infraorbital foramen. We create a 1, 2, 3-sided flap. Lift the flap, create our bone window, 2/3 to 3/4 of the root's overall length. So we've got a nice big window. We can see exactly where the distal and mesial borders of the tooth are. And then we can create a gutter adjacent to those borders. So nice and slim. Okay, so we've got a window and 1, 2 gutters. Don't go palatal, more likely to get oronasal communication. So we need to make sure that their depth is adequate as well as that the size of this window is sufficient. So 2/3 to 3/4 of the root's length, and here 2/3 to 3/4 of the root's thickness in depth. So here we go. Got a nice wedge, nice neat slim gutter on either side of this tooth. And if it's too big, then our instrument will slot in, but it will just sort of rotate round and round and do no good. If it is too shallow, then we rotate our instrument and it just pops out. But if it's deep enough and slim enough, then in slots our instrument and it hooks underneath a little bit of the tooth. And then if we rotate this gently and hold our rotation, it will enable all of these ligament fibers to loosen and our tooth to be extracted. So here we go. We raise a flap. We do windows, gutters, elevator in. My forefinger is going to rotate. Yep, and then I'm going to hold that for 20 seconds and then repeat on the mesial, and then keep on repeating, alternating mesial, distal, mesial, distal. Until out comes our tooth. Make sure that we've got a good bone clot and that we have nice, smooth, non-spiky, non-sharp edges to our alveolus. And then it's time to suture. Okay, and again, simple interrupted is ideal. The first ones will just approximate the flap where we want it, so in the corners, and then we do in between teeth, and then we'd fill in areas that we haven't already sutured about every 3 millimeters.